Dr. Nasrallah, how common is tardive dyskinesia?
It's actually quite common. When we talk about how common an illness is, we divide them into incidence and prevalence. Incidence in science means how many new cases develop per year. And prevalence means how many cases are there right now in the United States, if you measure them.
Okay.
So the incidence of tardive dyskinesia is actually it's different depending what kind of antipsychotic a patient's getting. The first generation, the older ones, had a lot of tardive dyskinesia. In fact, many studies, over 8 different studies, followed patients up for several years and found that in the first year of taking drugs like Haldol,
Right.
an older antipsychotic, 5 to 6% of the patients developed tardive dyskinesia. Second year, another 5 to 6%. Third year, another 5 to 6%. So over a period of 10 years, you can have up to 50% of the patients develop TD. So it's quite common. And we used to see it all the time in the first generation. Now that most patients are receiving second generation antipsychotics, they tend to have less acute EPS and less tardive dyskinesia, but not by much. It's about 2 to 3% per year. So even if we use the second generation in our patients to have less acute EPS, and we hope that they don't develop tardive dyskinesia, quite a few of them still do.
Can you explain for our audience what the difference is between first generation antipsychotics, as you said, and second generation antipsychotics?
Yes, the first generation antipsychotics were developed between 1953 to 1975. Okay, these drugs are very strong blockers of dopamine, and whenever we gave them to patients, they immediately develop rigidity, stiffness, akathisia, dystonia, all of the things, Parkinsonism, and that was like very uncomfortable, led many of them to stop their medication. So the poor patients who developed the acute EPS with the first generation, which was very common, had to be given drugs that would decrease the side effect, but have their own side effects as well. The second generation were developed after 1993, the vast majority of them. And they are called atypical, second generation or atypical, because they were not like the typical, they did not have the typical movement disorders of the first generation.
Fortunately.
Yeah, so they had less, but not completely gone. They had less acute EPS because they don't only block dopamine receptors, they block serotonin 2A receptor very strongly. In fact, more than dopamine blockade. And that blockade of serotonin 2A receptor mitigates and lowers the side effects, the acute side effects. And so we divide them into 2 generations based on the acute EPS. Tardive dyskinesia has been shown to occur in the same patients who develop acute EPS. They're very likely to develop TD. So that's why the second generation, which cause less EPS, they cause less TD, but not zero. Clearly 2 to 3% per year.
So I understand that all of the antipsychotics may cause tardive dyskinesia, including the medication clozapine. Can you talk about that?
Clozapine is the very first atypical, and it has zero acute EPS. I mean, it was like wonderful. It's almost unbelievable that it can get rid of the psychosis without causing discomfort, motor movements.
Right.
Yet, over the years, we have found out there's a lot of research studies published showing that even clozapine can cause tardive dyskinesia. Not as common as the others, but there are cases in the literature here and there, even with clozapine, because it still blocks dopamine, even though it's a weak blocker, and it blocks serotonin 2A much more. It's like all the atypicals were actually modeled after clozapine, but it can still cause TD, unfortunately.